Hi friends, welcome to my channel. Today we are going to discuss about rabies viral infection. Rabies is caused by rabdover. When there is a bite from an animal with rabies, the virus attaches to the healthy nerve cell. Then the virus multiplies, making a lot more viruses like itself. Those viruses move on and attach to other nerve cells until eventually they get to the brain. This process is continued from 30 days to 50 days to reach the brain, and this is called local infection. Once rabies attacks the central nervous system, it causes encephalitis. Inflammation surrounding brain blood vessels is often seen. Areas of the brain frequently targeted by the rabies virus are the hippocampus, limbic areas, medulla oblongata, and cerebellum. As the disease spreads through the brain, people become more confused and agitated. Eventually, coma and death results. The cause of death can be blockage of airways, seizures, excitation, or widespread paralysis. In 20% of people, rabies begins with tightening or paralysis of the limb that was bitten, and this is known as hydrophobia. Why hydrophobia cause? Generally, rabies virus can't live in saliva. Why? Because it reduces the virus ability to spread. So this virus causes stiffening of the throat muscle. It causes unexplained pain. Through that, patients cannot able to drink water, and it causes some fear. And this is what hydrophobia. And it shows some symptoms like fever, headache, nausea, vomiting, anxiety, confusion, hypersensitivity, abnormal behavior we can see. Can we get rabies without bite? People usually get rabies from the bite of a rabid animal. It is also possible, but rare, for people to get rabies from non-bite exposures, which can include open wounds that are exposed to saliva or other potentially infectious material from rabid animals. What happens if rabies untreated? If a rabies exposure is not treated and a person develops clinical signs of rabies, the disease almost always results in death. What are the tests for rabies? Saliva, serum, spinal fluid, skin biopsies of hair follicles at the nape of the neck, and this is called RT-PCR, reverse transcription polymerase chain reaction. Serum, spinal fluid treated for antibodies to rabies virus. When rabies symptoms start? The first symptom of rabies can appear from a few days to more than a year after the bite happens. At first, there is tingling, pricking, or itching feeling around the bite area. A person might have a flu-like symptoms such as fever, headache, muscle aches, loss of appetite, nausea, and tiredness. Can rabies cause sudden death? Sudden death without recognizable signs of illness is known. Sudden death without recognizable signs of illness is also not uncommon. Can rabies transfer through milk? Can rabies transmitted through food, milk, or meat? Rabies virus is killed by heating, therefore eating potential milk. Therefore, eating pasteurized milk or cooked meat is not an exposure. However, drinking unpasteurized milk from a rabid cow or goat is considered as an exposure. There are some animals that can't get rabies. Squirrels, guinea pigs, rats, mice. They have a special immunity that is called racial immunity. If you want to know more about immune system, then you can see immune system videos are available in our channel. Treatment for rabies. Post-exposure prophylaxis. Vaccine can prevent infection. This vaccine is developed by Louis Pasteur. Emile Roix developed first vaccine and names Rabavet, Rabipur, Rabivax, and it can be administered intramuscular. Okay, we will discuss another important topic in next video. Bye friends.